Hi there, my name is Dr. Dominic Rowley and I'm the Medical Director of Let's Get Checked. I'm here today to talk to you about hepatitis, namely hepatitis B infection. So what is hepatitis B? Well, there are a number of different types of hepatitis infections, and B being one of them. So there's also hepatitis A and C and D and E infection, but today we're going to talk about hepatitis B. So hepatitis B is known, or what we call in medicine and medical terms, is a DNA virus, and it affects the liver predominantly, leading to a condition called hepatitis, which is inflammation of the liver. Now, how is hepatitis B transmitted? Well, hepatitis B is transmitted in a number of different ways. The first way to mention is through unprotected sexual intercourse, and this could be oral, anal, or vaginal intercourse. The second way that hepatitis B can be transmitted is through the sharing of needles or infected medical equipment. The third way that hepatitis B can be transmitted is through infected blood products. The fourth way that hepatitis B can be transmitted is through sharing of items such as razors or toothbrushes, because hepatitis B is also found in saliva. So what are the signs and symptoms of having hepatitis B? Well, the good news about hepatitis B is the vast majority of us, if we get infected with it, our own immune systems clear the virus. But in a small minority of patients, they become chronic carriers, so they have a chronic hepatitis, so the virus is always active in their bloodstream. So signs and symptoms of having hepatitis would be, you may have a flu-like illness, so you may feel like you've got a very severe flu. You may be suffering from extreme fatigue. You may develop abdominal pain, particularly in the right side here where your liver is. You might have liver pain, and you might develop signs and symptoms of jaundice, which is classically the yellowing of the sclera of the eyes. And you may develop a severe itch, and this is also due to jaundice. So they're just some of the signs and symptoms of having hepatitis B. So how do you go about getting tested for hepatitis B? The only way of getting tested for hepatitis B is by having a blood test. What are the complications of hepatitis B? Well, as I mentioned, most of us clear hepatitis B ourselves, and we don't carry it chronically. We don't become chronically infected with hepatitis B. However, for the small minority of patients who do get chronically infected with hepatitis B, it can lead to very serious complications. Those complications, as I mentioned, include hepatitis, which is inflammation of the liver. If hepatitis continues unchecked or untreated, it will lead to a condition called cirrhosis. This is hardening or thickening of the liver, and the liver stops functioning as it should. And it can also lead to hepatocellular cancer or cancer of the liver. If you're concerned at all that you've come into contact or you've been exposed to hepatitis B, or indeed you might have hepatitis B infection, please visit our website and Let's Get Checked and speak with one of our nurses, and they'll advise you with the best test that is suited to your needs.